Let's bring in the Secretary of Health and Human Services, Alex Azar, right now. Secretary Azar, thank you for joining us this morning. I see that sign behind you. It says wear a mask. Should President Trump be saying what Joe Biden was saying this week? Every American should wear a mask right now.
George, we've been saying since the middle of April when we did the reopening the American economy, wear your face coverings, wash your hands, watch your distance, wear your face cover when you can't wear a mask. I got behind me the message to wear a mask. President's called it patriotic to wear a mask. I think everyone's together on this. The data supports this. If you're a meter apart and both of you are wearing a mask, you can reduce viral transmission by over 70%, protecting you and the other person.
We heard Dr. Redfield say this week we're heading for what could be the worst public health crisis in American history. Some forecasts show more than 500,000 deaths by late spring. What should Americans be braced for?
George, we're quite concerned about where the disease is spreading, as well as the Thanksgiving spread of disease, and we're worried about people and the behaviors coming up with Christmas. We want to make sure everyone's loved ones are there next Christmas, especially when we have so much hope of vaccines. So we're on a forward footing, George. We have complete visibility into our hospital capacity. We're making sure they've got supplies and staffing, regulatory flexibility so they can keep the highest acuity patients in the hospital, let others be serviced at home. And we want to make sure the therapeutics we've got are being used by doctors most effectively to keep people out of the hospital so we increase our capacity.
You're seeing some new stay-at-home orders taking hold in the state of California right now. Should other states and localities be following that lead?
So, George, what we say is all of our interventions need to be science and evidence-based. And what do we know? We know that flying on an airplane, we know going to work, we know universities, K through 12 schools, these aren't major vectors of disease transmission. We're seeing it spread from multi-household gatherings, overcrowded indoor restaurants and bars. These are the settings where our interventions need to take place because we've got to build public support. People are tired here and in Europe. They're walking away from these interventions because they're fatigued by it. And that's why the core message is wear that face covering and keep social distance. That's what's going to get us most through this. And the reason is we have these vaccines coming. And so there's so much hope ahead, and we just want to make sure everyone gets the benefit of it.
You talked about overcrowded restaurants and bars. There are reports now that the Secretary of State Mike Pompeo, Vice President Mike Pence, the White House, President Trump, all having these huge holiday parties, up to 900 people.
Well, George, our advice remains the same in any context, which is wash your hands, watch your distance, wear face coverings when you can't watch your distance, and be careful of those indoor settings. So my advice to anyone in any setting that's indoors is keep your guard up. Don't let your guard down. Just because you know people is not a reason to take that mask down. Be careful. The best thing is distance, and so certainly limiting the number of people at gatherings also can be important.
Have you advised the White House of that and the Secretary of State?
George, our advice is the same for every setting, which is maintain social distance, and when you can't, wear face coverings. The data is clear.
We know the FDA is meeting this week. The advisory committee is meeting on the FDA to talk about the vaccine. Any reason to believe that the vaccine will not receive emergency use approval?
Well, George, I'm very clear. I'm going to defer to the FDA career scientists on this. I'm going to protect the independence and integrity of that decision making. I don't know of any reason why the system is in any way off track. If things are on track, the advisory committee goes well. I believe we could see FDA authorization within days, but it's going to go according to FDA's gold standard processes, George, and I'm going to make sure it does.
I appreciate why you would stay out of that. How about going forward, if the approval does come, when should most Americans expect they're going to be able to get this vaccine?
You know, George, it's going to be progressive, and so we're going to focus on those most vulnerable and those most on the front lines of treating people with COVID with the initial 40 million doses in the next month. And then we're just going to progressively keep adding more and more people. So be thinking in the February-March timeframe that you're going to see more general vaccination. And by the second quarter of next year, we'll have enough vaccine for every American that wants it. But more and more people are just going to keep progressively getting vaccinated week by week as the product rolls off the line. And as we hope to add, maybe AstraZeneca, maybe Janssen, J&J, additional vaccines in the January-February timeframe, George.
How about this next phase? Where do you come down on this? There seems to be some tension between having essential workers get the next tranche of the vaccine versus having the elderly who are most vulnerable to get it. Where do you come down on that?
Well, we haven't had the Advisory Committee on Immunization Practices give us their recommendations on that next tranche of people. I'm very concerned about the vulnerable personally. I'm very concerned about the elderly. I'm very concerned about ethnic and racial minority groups that have suffered such a disproportionate impact in terms of the burden of this disease. But I want to get the best advice in here as possible before we make recommendations to our governors. And, our governors make the call at the end of the day on whom they will prioritize.
Dr. Redfield also said this week that as a nation, we were severely underprepared for the pandemic. As you approach the end of the Trump administration, any thoughts on what more could have been done? Any regrets?
So, George, this was a really unprecedented pandemic. We had done a lot to prepare for pandemic influenza. I led those efforts in the Bush administration, but this coronavirus brought many new dimensions. So we've learned more about how to improve our testing system. We've created a next-generation strategic stockpile. We've created better data systems, the one I mentioned earlier, that give us complete visibility into our hospital system for the first time ever. And we have Operation Warp Speed that's allowed us to bring therapeutics by the fall, vaccines within 10 months of this pandemic hitting our shores. So we've been learning through this unprecedented pandemic and just trying to improve every step of the way.
Secretary Azar, thanks very much for your time this morning.
Thank you, George.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.